Today, I'm going to give you a brief account of aviation and space physiology. In these situations, the problems which are faced by human body homeostasis are listed on the screen. Uh, but let's first talk a little about the stresses of flight, which are hypoxia definitely, and then there is dysbarism, which is a collective term for all the illnesses resulting from changes in the ambient pressure that occur at exceeding the capacity of a person to adapt safely. The other stresses include thermal stress, dehydration, noise, and actually the list is long. So the stresses include G forces also, then immobility, motion sickness, anxiety, fatigue, spatial disorientation. Now, what is it? It is the inability to determine one's position, location, and motion in relation to Earth as a reference point. Now the list continues with the third spacing, which occurs when too much fluid moves from intravascular space into the interstitial, means the third space, which in fact is a non-functional area. And this can cause edema, reduced cardiac output, and even hypotension. Uh, then there is distemporism. Now, don't get all worked up by this term for jet lag. And what is jet lag? It is extreme tiredness after a long flight across different time zones. Now, let's dig a bit deep into acceleratory forces and the effects of these acceleratory forces on the body in aviation and space. Many of these forces they affect body during flight because of the rapid changes in velocity and direction of the motion in the airplanes and the spacecrafts. Here is the list of types of the active forces. You can see that the acceleratory forces could be linear or centrifugal. Simple linear acceleratory forces they apply at the beginning of flight, while the centrifugal ones they exert their action every time an airplane or a spacecraft turns. And then there are deceleratory forces which come into action at the end of flight. In case of airplane travel, uh, centrifugal forces they are of prime importance as compared to the linear forces. When an airplane it makes a turn, the force of centrifugal acceleration comes in action, and it is labeled as G force. Now you can use this formula to calculate the centrifugal force. And what else this equation is showing? You see, as the velocity increases, the force of centrifugal acceleration increases in proportion to the square of velocity, while the radius is the most important factor in this equation. And one more thing you should know is that the centrifugal force is directly proportional to the sharpness of the term, which tells you that if the radius is less, that accounts for a more acute or sharp turn and more centrifugal force. So when we measure this acceleratory force, this G could be positive or negative. The weight of the aviator on his seat due to gravity is a force, and intensity of this force is said to be positive 1 g. If this force increases, it is positive g, and if this force decreases, the g force becomes negative. As you can see in this figure, that when the aircraft is flying level, then the force is positive 1 g. But when the aircraft goes into dives, then the g force becomes negative. And when the aircraft it pulls out of the dive, then the force again becomes positive. Now, let's get into the detail of positive and negative G. The positive centrifugal acceleration induces positive G force, and it is observed when the airplane begins to pull out after going into a dive, in which the pilot, or you can say the aviator, is pushed against his seat with a force much greater than his weight. Uh, Next, let me tell you the effects of centrifugal acceleratory force on the body. The major effects of positive G during acceleration, they are on the blood circulation. So when the G unit increases to about 4 to 5 G, the blood is pushed toward the lower parts of the body, including abdomen, and the cardiac output decreases, resulting in reduced blood supply to brain and eyes. Why our circulatory system undergoes these effects? Because blood is mobile, and hence it can be translocated by these centrifugal forces. Now, it's evident that the blood flow is also decreased, which in turn decreases the oxygen supply to head. And this leads to certain disturbances, such as gray out, blackout, or even the loss of consciousness. And in extreme cases, it could result into fracture of bones also. Now, you must be wondering, what is this gray out thing? It is the graying of vision that occurs when blood flow to eyes starts diminishing. And it occurs because the retina is more sensitive to hypoxia than brain. Although the physical impairment does not occur, but this gray out is considered as a warning for decreased blood flow to head. Well, you might have heard the word blackout in a different context, but here it means the complete loss of vision that occurs when retinal function is affected by hypoxia. However, the consciousness and the muscular activities, they are still retained, but still it indicates the risk of loss of consciousness. All right, now let's see that what happens when the force is increased beyond 5G. Then the hypoxia reaches the critical level, causing the loss of consciousness, which may be associated with the convulsions. This unconscious state may last for about 15 seconds. But even after recovery from unconsciousness, the person still needs another 10 to 15 minutes for orientation. So you can see that if the affected person happens to be a lone pilot, then he will lose control over the aircraft. Remember, I mentioned bone fracture. So, if the force increases unfortunately to about 20 G, then the bones, particularly the spine, becomes susceptible to fracture even during the sitting posture. Problems with the high altitude temperature could be concluded from this chart. Uh, you can see that as one ascends to higher elevations, the temperature get colder, and the solution could be special clothing for the aviator or the pilot, or the special heating apparatus which must be designed for flying at high altitude. Now, if you have to summarize the effects of positive G, you could write them under these two headings. The most important effect is on the circulatory system. Suddenly applying a positive 3.3 G to a sitting person, it causes both systolic blood pressure and the diastolic blood pressure in upper body to fall below 20 and 10 millimeter of mercury respectively for first few seconds after the acceleration begins. But with within another 10 to 15 seconds, the baroreceptor reflexes they are activated, and the blood pressure it returns to about 55 by 20. Now, as the blood centrifuges to the lower extremities, a great distension of the veins of abdomen and legs is observed. Plus, there is increased vascular capacity, venous pooling, decreased cardiac output, and decreased blood flow to brain would result in what? Yes, gray out, which actually is the loss of color perception. Progress then it will progress to the blackout and unconsciousness followed by death. Effect on skeleton, especially the vertebrae, it causes fracture. So the question is that how these effects might be prevented. You see, the body can be protected from the effects of these G forces, particularly the positive G, by using abdominal belts, and then there are anti-G suits, uh, which are used as anti-blackout measure, because these anti-G suits they have inflatable airbags which actually delay the onset of blackout, and then by lying prone, body can withstand a positive 15 G force in this horizontal position. Next problem is the venous pooling in the abdominal blood vessels, which is prevented by using the abdominal belt and by leaning forward while sitting in aircraft. Because these procedures they also postpone the gray out and the blackout. The anti-G suits they also help in this as they exert a positive pressure on the lower limbs and the abdomen and prevent the pooling of the blood in lower parts of body. Let's talk about negative G now. This negative G develops while flying downwards, which you can also term as inverted flying. And it causes the disturbances like hyperemia, red out, headache, and again the loss of consciousness. I'm sure you all know that what is hyperemia. Yes, it is an abnormal increase in blood flow. So when the force decreases to -4 to -6 G, hyperemia occurs in head because the blood is pushed toward head. Sometimes the blood accumulates in head, resulting in brain edema. And also there is congestion, flushing of face, and mild headache. The negative G at this level, it is tolerable, and the effects they are only momentary. It means that the brain, it can also withstand hyperemia in such conditions. Now the red out, it is the blurring of vision and sudden reddening of the visual field caused by the engorgement of the blood vessels in head. What happens is that when the negative G reaches to about -15 to -20, there is dilatation and the congestion of the blood vessels in head and eyes, resulting in red out and headache. Here the interesting thing is that the blood vessels in the brain, they may not be affected much because of the cerebrospinal fluid, because when blood accumulates in the brain, there is simultaneous cooling of the CSF in the cranium, and the high pressure which is exerted by the CSF, it acts as a cushion or a buffer, and it protects the blood vessels of brain. Well, don't be relieved yet, because high negative G, it affects the body by other means. It increases the pressure in the blood vessels of chest and neck, so it causes bradycardia or irregular heartbeat, which adds to the stagnation of blood in head. So all these factors, they ultimately lead to unconsciousness. Although these acute effects on the circulatory system, they are less dramatic, but they are more damaging permanently. Say at -20 G force, there is translocation of fluid in upper part of the body, causing intense momentary hyperemia of the head. Uh, Now the cerebral blood pressure reaches 300 to 400 millimeter of mercury, resulting in brain edema and red out due to the hyperemia in the eye. However, -4 to -5 G, there is no permanent harm, but just momentary hyperemia. Now let's focus on the deceleratory forces, especially the ones which are associated with the parachute jumps. You see a parachute aviator, when it leaves the airplane, his velocity of fall is at first exactly 0 feet per second. It gradually increases to 32 feet per second, 64 feet per second, and at 12 seconds, 110 miles per hour, reaching the terminal velocity. Now keep in mind that a parachutist relies on the atmospheric drag resistance force also, which is generated by open parachute to limit its velocity. What happens is that an opening shock load of up to 1200 pounds occurs when parachute is first opened. Here the force of air resistance becomes much greater than the force of gravity. Now the speed of landing is about 20 feet per second, which still can cause damage to body, resulting in the fracture of pelvis, vertebrae, or leg. So that's why a trained parachutist strikes the earth with knees bent but muscles taut to cushion the shock of the landing. Uh, that's it about aviation. Uh, let's move to our next topic, which is space physiology. Physiological atmosphere in relation to space, that is divided into four zones. Here you can observe that the zone where the actual weightlessness is observed, it lies above the altitude of about 200 kilometers. I believe that you all are familiar with the idea of outer space. It's a point above sea level where gravitational pull is no longer effective in preventing the molecules from escaping into the true space. And it is also called escape level. The name escape level, it was coined by the creator of popular science fiction Star Trek. Uh, Now, this escape level is situated approximately 700 kilometers, or you can say 435 miles from the surface of Earth. Space physiology is the study of physiological responses of the body in space and spacecrafts. Here I have mentioned the major differences between the environments of Earth and space. These three factors, they are the characteristics of space environment which challenge the human survival. So the atmospheric factor, it include not only the atmospheric pressure but also temperature, humidity, and gas composition. Well, just like we focused on the acceleratory forces earlier, now here again we will see the effects of these forces on body in space. These forces have tremendous effect in space travel at two stages. One is the blast off acceleration, which exerts a positive force, and the second is landing deceleration with its negative force. So, if you are not snoring already, did you notice that I have mentioned the linear force? Because the centrifugal acceleration, this is of little importance in space travel because the spacecraft cannot make rapid turns except when it goes into abnormal gyrations. Now, this figure is showing the linear acceleratory forces at the takeoff. A spacecraft, it is put into the orbit within 5 minutes using the rocket propulsions from one or more boosters. Now, the first stage booster exerts a linear acceleration as high as positive 9g, while the second stage booster's linear acceleration is around positive 8g. And at the end of the 5 minutes, the spaceman enters the state of weightlessness. Since you know from the previous knowledge that in standing and sitting position during takeoff, a spaceman cannot withstand more than positive 4g acceleration. So, what do you think is the best position at the takeoff or the liftoff? It is the semi-reclining position, which is transverse to the axis of acceleration. The linear deceleration when returning to Earth, the spaceship must be slowed down at a certain distance for the safe deceleration. And for that, the spaceship traveling at a speed of Mach 1, which is the speed of sound, requires a distance of around 0.12 miles. So, to summarize the effects of the travel by the spacecraft, I can say while traveling by spacecraft, the astronauts experience some intense symptoms only during blast off due to the acceleration and during landing because of deceleration. Uh, Otherwise, the acceleratory forces they are least while traveling in a spacecraft, since the spacecraft cannot make rapid changes in speed or direction like an aircraft. Well, the next topic in your book is artificial climate, so let's cover this too. Since there is no atmosphere in outer space, so an artificial atmosphere and climate it must be produced in a spacecraft. As a result, the spacecraft or the space lab it has a stable and sophisticated environmental control system which maintains all the atmospheric factors close to Earth's atmosphere. Moreover, the astronauts they also wear launch and entry suits, which is here designated as LES. This launch and entry suit, this is a pressurized suit that protects the body from space environment. An atmospheric pressure of 769 millimeter of mercury, it prolongs the space travel. Although oxygen needs to be recycled. Another factor which affects the body in space is weightlessness. This weightlessness is because of the absence of gravity. Because there is a near zero g force, so we term it microgravity. Now, what it means? It would imply that no force is pulling the spaceman in any direction toward any part of spaceship. The most important thing is that most of the physiological changes occur due to weightlessness in space travel. So, what are these problems of microgravity? You better write these down. Number one, there is motion sickness during the first few days of travel. Then comes the translocation of fluids within the body because of the failure of gravity to cause normal hydrostatic pressure. The funny bit is this translocation it results in puffy face, which none of the sci-fi movies show you. Next, why the muscle deconditioning take place? You see, it is due to the diminished physical activity because no strength of muscle contraction is required to oppose the force of gravity. And our cardiovascular system responds by a slight decrease in the blood volume due to the relaxation of smooth muscles of blood vessels of lower body. Then, limited supply of oxygen and other nutrients in space. That is quite a limiting factor in the interplanetary travel for several months to years. Solution lies in recycling procedures to complete the food chain either through physical or biological process. Distillation and electrolysis of water to release oxygen they are used as physical processes while the biological ones they use algae. You all know that we humans are protected by Earth's atmosphere from space radiation, and the radiations present in space are gamma rays, X rays, cosmic rays, and many more. So, adequate radiation shield must be provided to spacemen. Moreover, outside the Earth's atmosphere, there are Van Allen radiation belts, which are 2 points in space extending in the equatorial planes of Earth, and they constitute inner and outer belts. Now, certain precautions are taken in this regard, like 300 miles space travel around the Earth. It must be confined to certain altitudes, and it must take place mainly from one of the two poles. And also, the spaceship, it must go through these radiation belts very rapidly. There are few other problems also in space, such as exposure to extreme heat when in the direct pathways of sun rays. Can you imagine the 3000 degrees centigrade due to extreme kinetic energy? Well, luckily the molecules, atoms, and ions, they are too few to impart the significant amount of heat to the spacecraft. Anyway, these spacemen, they are provided with the intricate heat control systems. Then there could be exposure to extreme cold when it is on the opposite side of the moon from sun rays. And for that, appropriate clothing is required, of course. In case of decompression of the spaceship, a very low barometric pressure, it necessitates the spacemen to wear pressurized space suits. Then the exposure to the ultraviolet radiations, it may cause severe sunburn and even blindness. So spacemen must be provided with protective clothing and filters for eyes. Now, this could easily form a university question, so you better write this down. So, among these effects, there will be a decrease in blood volume, red blood cells mass, impaired barometric reflexes, reduced orthostatic tolerance, and also the reduced cardiac output, which could be maximally achieved. Then the astronauts, they also experience a decrease in muscle strength and work capacity because of the loss of calcium and phosphate from the bones, as well as the loss of bone mass. So the bones, they become susceptible to fractures. You should know that the bone deposition, it requires an extra stress of gravity. So microgravity will decrease the calcium and the phosphate deposition, and also it causes a hypercalciuria and increased risk of renal stones. Excessive exercise programs, in this case, they provide a solution to reduce the ill effects of prolonged stay. In short, the physiological consequences of prolonged weightlessness, they are similar to those which are experienced by the people who lie in bed for an extended time. And for this reason, as I already told you, that extensive exercise programs are carried out during prolonged space missions. So most of the effects mentioned are greatly reduced except for some bone loss. In previous space expeditions in which the exercise program had been less vigorous, astronauts had severely decreased work capacities for the first few days after re entering to Earth. And they also had a tendency to faint when they stood up during the first day or so after returning to gravity. The reason for this, I'm going to tell you in a moment. But keep in mind that even with an exercise program, this fainting, it continues to be a problem after prolonged weightlessness. Now, the reason why a spaceman has difficulty readjusting to the weightful state of normal positive 1g is because the circulatory system that is adjusted to weightless state, and these adjustments they include reduced blood volume, dilated blood vessels in the lower extremities, and diminished response to arterial blood pressure control mechanism. So, upon facing gravity, more blood is pulled to the lower extremities, which results in brain anoxia and hence fainting. Well, fortunately, this condition is readjusted in 1 to 3 weeks. So hopefully we have covered everything related to the space physiology. Next time we will start with the deep sea physiology.